says it plans to remove the black box warning on many hormone treatments.
In an opinion published today in the Wall Street Journal, the FDA commissioner said these are the strongest drug warning the agency can require, and they have inappropriately scared women off from this life-changing and sometimes life-saving treatment. Joining us now to talk more, Dr. Lucky Sekhon. She is a board-certified reproductive endocrinologist and an infertility specialist and an OBGYN. It's great to see you. So is the FDA removing these black box warnings essentially because there is more evidence that it's safe to do hormone replacement therapy?
It's not really based on any new evidence. There isn't a new journal article that just came out. I think it's really in the spirit of a culture shift where in the past, especially starting in the early 2000s, when some very large trials came out and showed that there were increased risks that were then listed on the black box label, like breast cancer, cardiovascular disease, stroke, blood clots, just to name a few examples. A lot of people became very afraid.
Yeah.
And as a result, a lot of women went without care, even if they were looking to talk to their doctor about menopause hormone therapy. And a lot of prescribers were very nervous about it. But we have a lot more information, even from looking at the data within that trial, that there's more nuance behind it. And so they're not taking away the black box label and saying, this is safe for everyone, we don't have any risks to worry about. But we're told that they're going to replace it with more nuanced language surrounding who's a good candidate, the duration, when it started. We know that starting menopause hormone therapy within the first 10 years of menopause,
can
those
make a
women
big difference.
Are at a lower risk of these types of outcomes.
And can you remind us why a woman would get onto hormone replacement therapy and what some of those risks are briefly?
Yes. So hormone replacement therapy, we now call it menopause hormone therapy for women over 45 who are experiencing things like night sweats, hot flashes, vaginal dryness, urinary symptoms. There can be recurrent UTIs, which is not only a quality of life issue, but a major health problem. And so you can replace the estrogen that's deficient and alleviate some of these things, even, low bone mass density. And so it's important for people to know that there are risks, cardiovascular, breast cancer, but it depends on who you are, your risk factors, and the different formulation you're using.
You got to talk to your doctor individually.
Exactly.
While we have you, can I ask you about a different subject? The New York Times, they reported about fetal monitoring of pregnant women leading to what they describe as unnecessary C-sections. What is fetal monitoring? What's going on? And why is this happening?
So anyone who's ever been on labor and delivery, those monitors that pregnant women are strapped to, that's continuous electronic fetal monitoring, and it's looking at the fetal heart rate in a continuous fashion, as well as measuring the uterine contractions. And it's one major data point that doctors are using when they're monitoring the status of the fetus during labor and delivery, which can be very stressful, with especially contractions. You're looking at, is there reduced blood flow to the placenta and to the baby? Is there reduced oxygenation, and what can we do? And the only intervention isn't just C-sections. There could be resuscitative measures, turning the mother on the side, trying to improve blood flow.
And, a lot of people might think more information would be a good thing, but a lot of critics of this are saying it's not helping the mom or the baby. Can you explain the controversy for us?
Yes, so there's a controversy because, like any test in medicine, it's not perfect. It's not a crystal ball. And while it can give you valuable information, they drill it down to 3 categories. You can have category 1 results, which is very reassuring. Category 3, not reassuring at all, you need an intervention. But there's this gray area of category 2, which is subject to interpretation. And because of the medical legal climate in this country, where a lot of obstetricians can be sued when there's a negative outcome, there can be this knee-jerk reaction to over-intervene.
Meaning do a C-section?
Yes,
sometimes.
But I think that this article missed a huge point, which is there are a lot more high-risk pregnancies, and that in and of itself is a risk factor for C-sections.
Right, Dr. Lucky Sekhon. Thank you.